Good afternoon. This is Peter Thomas, the NAAOP General Counsel, speaking from Washington, D.C. I wanted to speak today about the state of orthotic and prosthetic research and development. There's an awful lot of activity on this topic recently, and I wanted to report what's been occurring. First off, let me start at the beginning. The NAAOP was created as the American State-of-the-Art Prosthetic Association way back in 1987. A group of both orthotic and prosthetic pioneers, really, clinicians that had a real interest in research, were concerned that there was not enough federal investment in O&P research. And so we set about trying to create a federal funding stream. That resulted in a piece of legislation that passed in 1990. It was enacted. It created the National Center for Medical Rehabilitation Research, the NCMRR, at the National Institutes of Health. And that center ultimately has funded O&P research ever since, mainly through a program called the SBIR program, the Small Business Innovation Research Grant Program, but also through large grants called R01s and other types of vehicles that usually academic health centers, medical centers receive and conduct and support research in the area of orthotics and prosthetics. The fact is that the field really does need to develop evidence, as all healthcare fields need to develop evidence in order to eventually get their services covered and paid for by private payers, by Medicare, and by pretty much anyone that's paying the bill for healthcare. Evidence-based medicine is a mantra these days, and O&P research needs to occur in order to keep pace with other healthcare fields, and we need to get out and make sure that we have a solid foundation for the care provided by O&P practitioners. So it's an important endeavor. Just last week, the National Institutes of Health, 25 years after the inception of the NCMRR, held a major conference on rehabilitation and disability research. And included in that conference were O&P researchers who reported on the state of O&P care and the state of O&P research activity, including Brian Hafner, by the way, from the University of Washington. I attended the conference on behalf of NAAOP and the O&P Alliance. There were other O&P leaders in attendance. There were over 500 people at that conference, and it was a smashing success. And to see where that center has gone in 25 years was really thrilling. It just so happens that this conference was part and parcel of an initiative that the NIH is undertaking to update their priorities in the rehabilitation research area, inclusive of O&P research. And remember that the center actually has as part of its mission to conduct medical rehabilitation research, including orthotics and prosthetics research, and that's a quote. We're the only specific type of research in the rehab field that's mentioned in that statute. The research plan hasn't been updated since 1993, and that's exactly what the NIH is doing, is conducting and supporting such research and developing that research plan to update the priorities. But there's another broader priority setting process taking place in rehabilitation medicine as well, and that's being conducted by something called the ICDR, the Interagency Committee on Disability Research. That's taking place out of a different federal agency within the Department of Health and Human Services. The ICDR is tasked with coming up with a government-wide strategic plan on rehabilitation and disability research. And they, too, are embarking upon a priority-setting process right now that is inclusive of O&P research across the federal government. So within 6 months or so, we should have two very significant research plans and priorities in the rehab area that include a very significant focus on orthotic and prosthetic research, and we couldn't be more happy about that. It makes it so much more relevant that the O&P Alliance and NAAOP is meeting with 5 federal agencies just next week. We're preparing to meet with the National Science Foundation, the NIH, the National Institute on Disability and Rehab Research, the Department of Defense, and the VA. All of those agencies are responsible for a fair amount of O&P research activity, and we're going in to share priorities, to develop good relationships with them, and to maintain those relationships into the future. That's the way that eventually, with efforts that are complementary to that, like Prosthetics 2020, that AOPA is conducting, and other initiatives with the two research foundations in O&P, we're hopeful that we will build this evidence base in the field as quickly as possible to lay the foundation for high quality care and ultimately coverage of the services that O&P practitioners provide and O&P patients need. Thanks so much.